Sup folks, welcome back to NeuroSketch, and today let's turn our focus into a very important bone right at the center of the chest, the sternum. This bone stands at the front line of the thorax, so small but plays critical role in protecting vital organs, not to mention the heart. But it also serves as an important landmark for clinical practice. By the end of this discussion, you will understand not only its anatomy, but most importantly, why do clinicians pay so much attention to this tiny bone. So whether you're a medical student, clinician, or just curious about the human body, this video provides a solid understanding of the sternum. All what you need to do is to subscribe for free, grab a piece of paper, and let's talk about the breastbone. So the sternum is also known as the breastbone, and it is found on the anterior chest wall. So it is found under the axial skeleton. It is a flat bone and measures about 15 centimeters in length. The primary responsibility of the sternum is to protect the structures that are lying deep within the chest. But the biggest structure that is in close proximity with the sternum is the heart. So the heart is lying just behind the sternum, just behind the sternum. In fact, when the heart stops pumping, we want to initiate the cardiopulmonary resuscitation, compressing the chest. So we are compressing the chest, but where exactly do we compress? We usually compress the sternum because the sternum is in close proximity with the heart, and so it will transmit the compression into the heart, and so the heart will begin to pump. Yeah. So there's a close proximity between the sternum and the heart. So sometimes the sternum is formed from two sternal bars, with one from the left, one from the right, and then they're fused during embryological development. The sternum is formed from two sternal bars, one from the left, one from the right. They're fused to form to complete the sternum. So sometimes fusion is not perfect, so we have conditions like cleft sternum. But when the sternum does not form, the heart will budge outside, as in condition like ectopia cordis, in which the sternum doesn't form. So the heart is protruding outward. Why? Because the breastbone is not there. The breastbone was supposed to protect the heart, but it's not there, and so the heart is budging outside. So the relationship between the sternum and the heart is very important, and at this point we won't talk about everything, things like the chambers of the heart, listening to heart sounds in relation to sternum, because the sternum forms a very important landmark for the discussion of the heart sounds. But because we haven't discussed anything about the heart, we cannot discuss these heart sounds at this point. But the things like the valves of the heart and all that. So when we're discussing about the heart, anatomy of the heart, I will bring again this discussion of the sternum versus heart, But at this point, I think it is wise to carry on. So the sternum has got three parts. It has got the manubrium, the body, and the xiphoid. Manubrium, body, and the xiphoid. So assume the sternum to be as a sword, like this one. So the manubrium part, manu means hand, correspond to the handle of the sword, but the body of the sternum correspond to the blade, like the body of the sword, the blade, and then the tip of the sword correspond to the tip of the sternum, which is known as the xiphoid. In fact, the word xiphoid in Greek means the sword. So we are not surprised that the xiphoid is like the tip of the sword. But also you can see that the sternum is like a letter T. So it's like a little bit like a letter T. Yeah. So some book they describe the shape of the sternum as some like a letter T. But we're going to discuss each part in turn, starting with manubrium part of the sternum. So manubrium is also known as manubrium sterni, which means the manubrium part of the sternum, but is the thickest part of the sternum, thickest part of the sternum. It forms joint with clavicle bilaterally. So clavicle bilaterally, the first rib bilaterally, so pair of first rib, and then a joint also with the body of the sternum, So that is the manubrium part of the sternum. It has got the top part of So the top part of the top notch, the topmost notch of the of manubrium is known as the suprasternal notch. Supra means above, sternal means sternum. So it's a notch just above the sternum, just above the sternum. But it is also known as the jugular notch because it has a relationship with the jugular vessels. Next to it, the body of the sternum. The body of the sternum is also known as the mesosternum. This is the longest part of the sternum. The manubrium part was the thickest part of the sternum, but this is the longest part of the sternum. Is known as the body of the sternum, which is the mesosternum. So it is formed by individual bones, which are known as sternabrae. So we actually have 4 sternabrae, which are so before puberty. So before puberty, we have like individual 4 sternal bones, which are known as sternabrae, which are joined by hyaline cartilage. So they are primarily the temporary cartilaginous joint, and from the age of from puberty onward to the age of 25, the fusion takes place, and so we are changing from the temporary joints into bones in the process known as synostosis, as we discussed the discussion of the joint. So the sternum is actually formed, the body of the sternum is actually formed by individual bones, which are known as sternabrae. And so we are born with the sternabrae, which are joined by cartilages, and then from puberty onward until the age of 25, the fusion takes place, and so we are forming a bone. So we're moving the joint, we're moving the cartilages to form the joint in the process known as synostosis. This is how the body of the sternum forms. But the body of the sternum, it makes joint with the manubrium sternum, with the costal cartilage of volume 3, 4, 5, 6, and 7, but it also forms a joint with the xiphoid process. Okay, lastly, let's talk about the xiphoid. The xiphoid is also known as the xiphisternum, or the xiphoid process, and as we've said, it is the Greek word for sword. But it is most cartilaginous. It is cartilaginous to most people before the age of 40. So before you go to your 40s, your xiphoid process is mostly cartilaginous. So it starts ossification, changing to bones, into a bone structure from the age of 40, but the complete ossification is by the age of 60s. It is a part of the sternum which has very a wide range of anatomical variation. The xiphoid process is the only part of the sternum that goes to a wide range of variation of anatomical variation. So to some people it might be bifid, like it has 2 branches. It might be curved with the curvatures, but it might also have a foramen, a hole in it, which is foramen. Okay. So I think this is what we in Swahili we say the chemba moyo, something like that. I think this is what they mean. I believe this is what they mean by chemba moyo, because that they usually touch in this part, the lower part of the sternum here, and they say this is that is the chemba moyo in Swahili. I believe. I don't know. I'm not sure. All right. So the body of the sternum. The body of the sternum, when you're looking from the side, the body of the sternum and the manubrium part of the sternum, they are lying in different angles, and they are lying in different planes, and so they are creating an angulation here, which we call a sternal angle. So we have a sternal angle which is formed by the body of the sternum and the manubrium part of the sternum, because they are lying in different planes, and so they are creating an angle. So the sternal angle has got dozens of names. So it was discovered by a French scientist, a French doctor, who is known as Antoine Louis, and so this angle is also known as the angle of Louis. I understand we English speakers might call it Louis, angle of Louis, but I believe the correct French pronunciation is Louis. So it is also known as the angle of Louis, so the sternal angle or the angle of Louis, but it is the junction between, it is the angle between manubrium part of the sternum and the body of the sternum, so it is also known as the manubriosternal angle, manubriosternal angle. But it's a joint, right? It is a joint. So it's a joint between the manubrium part of the sternum and the body of the sternum. So it's also known as the manubriosternal joint. Manubriosternal joint. It has got also other less important names to us, like less important to us, names like angulus sterni, which means the angle of the sternum, and angulus ludovic, which are less important to us. But this is a joint, right? So it is a cartilaginous joint. But which kind of cartilaginous joint? It is the secondary cartilaginous joint. Remember, in secondary cartilaginous joint, the bones are brought together by a fibrocartilage, a fibrous cartilage or fibrocartilage, and so this bone, we said it is symphysis. I mean, this joint is symphysis. Which kind of symphysis? A narrow symphysis. A narrow symphysis. But the sternal angle, the angle of Louis, corresponds to the second costal cartilage, the cartilage for the second rib, right? So it corresponds to the cartilage for rib 2 or second rib. This is very, very important clinically. It is very, very important clinically due to the following reasons. Number one, the sternal angle, the angle of Louis, it corresponds to the second costal cartilage, and here is where rib counting starts. So rib counting of ribs will always start from the sternal angle or the angle of Louis here. Okay, so this is the patient. So the patient will come to you like this. So sometimes you need to count the ribs. I understand that at this moment you don't know why do we need to count the ribs, but it will come, like it will be obvious as you are moving in later part of the anatomy. Okay. So so the patient will come to you like this, and so sometimes you don't have, your eyes are not x-rays, so they cannot see through the muscle, so you rely on touching or palpating so as to count the ribs. So this sternal angle of Louis, it serves as an important landmark, because once you palpate it, if you go laterally, you find the costal cartilage, and you know that the costal cartilage for the second rib, so the second costal cartilage, and so the counting of ribs starts from there going on. Why is it hard to start counting from the first rib? Because the first rib is just beneath the clavicle, and sometimes it's hard to palpate. But the sternal angle, the angle of Louis and the second costal cartilage, they are relevant clinically, and they remain the cornerstone for the rib counting. Okay, but if you are standing in the line through the sternal angle of Louis, it corresponds to the arcing of aorta. Again, I know we haven't discussed about the aorta and how they branch, how they curve, but I believe we will understand later that the aorta is curving. So we have the curving of aorta, which is lying through a plane through the sternal angle of Louis. But also, the trachea is bifurcating to form two main bronchi, one on the left, one on the right. Where does the trachea branch off? It branches off at the level of the sternal angle of the angle of Louis, And then, if you extend this line posteriorly, it corresponds to the intervertebral disc between T4 and T5. Intervertebral disc between T4 and T5. But if that is not enough, the line through the sternal angle, the angle of Louis, it divides the mediastinum and the mediastinum into superior mediastinum and the inferior mediastinum. So this is very, very, very important clinically, and in an exam, especially in a practical exam, you might be asked to name the clinical relevance of the sternal angle of Louis, of the sternal angle or the angle of Louis. So number one, so in exam you'll be asked, number one, you find this region is painted, maybe green painted, and you ask name the painted area. So the answer will be the sternal angle or the angle of Louis, or manubriosternal angle or manubriosternal joint. All of these are correct. And then the second question will be, what is the clinical significance of this area? So you will mention the events. So these are the major events that are happening at the sternal angle or the angle of Louis. The major events that are happening on the sternal angle or the angle of Louis. So now I'll discuss about the joints of the sternum. So as you've seen, guys, the sternum is forming joint with the clavicle. As you have seen, the manubrium part of the sternum with the clavicle, and this joint is known as sternoclavicular joint. sternoclavicular joint. This is the synovial joint. So remember the features of synovial joint. It has got this the joint cavity and it is mobile. It has got the joint cavity and it is mobile. Again, the sternum also forms joint with the costal cartilages, hence this we call them sternocostal. Sternocostal. Costal means rib, but these are the costal cartilages. So it's the joint between the sternum and the costal cartilages. So we have the costal cartilage from rib 1 to rib 7 that are touching to the sternum, that are touching directly to the sternum. But the sternocostal joints, they are synovial joints. What the meaning of the synovial joint again? These joints, they have the joint cavity and then they permit movements. So the movements, like when you are breathing out, when you are breathing in, breathing out, the thoracic cage is moving, and so this movement is made possible by the presence of the joints. These joints we call the synovial joint, because remember the synovial joints are freely movable joint. They are freely movable joint, even though the degree of mobility, the degree of freedom differ. But this rule doesn't apply to the first costal cartilage, to the first sternocostal joint, because the first sternocostal joint, it is cartilaginous. And is primary cartilaginous joint. The first sternocostal joint is not synovial because it has got no joint cavity and it is tightly bound. The first costal cartilages of the first rib is tightly bound to the sternum, and so it is not mobile. So as we have seen, so we have the joint with the clavicle and the joint with the sternocostal with the costal cartilages, and so we have the notches for this joint. So we have the clavicular notch here at the topmost portion of the sternum, which is for articulation with the clavicle. And as we've seen, we also have the costal cartilages. So these are the costal notches. So we have the notches from the first to seventh. These for the articulation with the costal cartilages. So the sternum is highly supplied with the blood from the internal mammary artery. So we say we have the internal mammary artery or the internal thoracic artery that gives the sternal branches to supply the sternum. So the sternum is highly supplied with the blood from two internal mammary artery, one from the left, one from the right, and they are given sternal branches to supply the sternum to make sure the sternum is highly supplied with blood. So let's see the surface anatomy of the sternum, the chest region. As we've seen the other time, we've seen the pectoral region, but we say we have the sternum right here. So this is the sternum, and remember we are seeing this is just narrow area that is left because the pectoralis major muscle is attached on the anterior surface of the sternum. So this on the left side, this on the right side, so they're occupying most of the surface of the sternum, and so the only remaining part is this narrow part that we are seeing. So the topmost portion, the topmost notch of the sternum, we call it the jugular notch or the sternocostal notch. The suprasternal notch. The suprasternal means above the sternum, but the jugular means they have the relationship with the jugular vessels. What's another important thing about the anatomy of the sternum, guys? The sternal angle or the angle of Louis. Why is it important? Remember the 5 points you'll be asking your exam sometimes here. But we also have the chamber moil here, as we've said. So that is xiphoid process of the sternum. So sometimes the sternum can be cut straight into two halves. It can be cut straight into two halves. This is to get the room to observe the heart, because what did we say? The sternum and the heart, they are forming a very important relationship, because the heart is just behind the sternum. So when you cut through the sternum, you will expose the heart, and this is done for different heart surgeries, different cardiac surgeries, cardiothoracic surgery. So cutting through the sternum at this point here is known as the median sternotomy. So median sternotomy is cutting of the sternum into two halves so as to expose the heart. Why? Because you say the heart is just behind the sternum, and then after this the sternum is fixed internally, and then healing takes place because it has got rich blood supply. Okay, but healing sometimes is difficult because of constant movement of the sternum. Remember, the sternum is found on anterior chest wall, and so the movement of the respiratory movement, the resulting to movement of the sternum, so sometimes it impairs healing and makes healing takes a little bit longer, but it is highly supplied with blood. So we have some conditions in which we need to take the biopsy, the bone marrow biopsy. So sternum serves as an important landmark, as an important point for taking bone marrow biopsy. Why? Because the bone marrow biopsy, the bone marrow of the sternum, it is persistent throughout life. The red bone marrow of the sternum is persistent throughout life. So we have some other parts where you can take the biopsy, but the sternum also serves as an important point for taking bone marrow biopsy. Okay, so we said the sternum, the manubrium part of the sternum, the thickest part of the sternum, and so biopsy is usually taken from the manubrium part of the sternum. We have some conditions in which we have a foramen of the sternum, so foramen on the sternum, and so this condition is known as the sternoforamen. Sternoforamen is actually benign, it causes no danger to a patient, but it should be borne in mind when you want to do the sternal biopsy, because sometimes you don't know when maybe someone may have a sternoforamen somewhere here, and then you're going to insert needle, and so you are at risk of injury in these great vessels, which will result into life-threatening bleeding. So bleeding from here will be like life-threatening, and so you may lose the patient on table. So it is important to be borne in mind, like maybe you do chest imaging before you do the biopsy, right? To make sure that you don't have a congenital sternoforamen. So we have condition on the anterior chest wall, in which the anterior chest wall is bulging inward. Guys, this is known as the pectus excavatum. And what do we say about the pectus? The word pectus means chest, and then we have excavatum means this is the excavator. So what does it do? It digs. So the excavatum means hole. So this literally pectus excavatum literally translates into hollowed chest. Hollowed chest, like hole through the chest, is also known as the funnel chest. The funnel chest. So in this situation, the breastbone, the sternum, is bending inward, and then it bends with its corresponding costal cartilages. The costal cartilages are attaching to the sternum. When the sternum is bending inward, remember those are the cartilages, so they also bend and then they ossify. Okay, so we have this situation which is known the pectus excavatum. What is the primary purpose of the sternum? It is protect the structures that underneath, that are deep within the sternum. So when you have this condition, we have this situation in which the sternum is bulging inward, so we can have cardiopulmonary complications or cardiorespiratory complications. And so the symptoms proportional to the severity, the magnitude of the situation. So the symptoms of the pectus excavatum, they are proportional to the magnitude of the situation, depending on how severe the situation is. We also have another, quite the opposite to the pectus excavatum, is pectus carinatum, in which now the breastbone, the sternum is bending outward, giving an impression of the chest of the pigeon. So this situation is also known as the pigeon chest. All right, guys, this is this is what I had for you on the discussion of the sternum. And in case you have a question, additional comment, feel free to put your thoughts in the comment section below. But you can always swing by Instagram and TikTok and the NeuroSketch with Dr. Kenny. Do you have any question? Do you have anything that you want to write me an email? The email is here, and see you next time.